I'm happy to be here to present a common disease in our country and in the neighboring countries, which is Lifa disease. It is the local name of the disease known in the text as frictional dermal melanosis. This disease is a common pigmentary problem, especially in the Middle East, and it is a common problem in Iraq. And the local name of Lifa disease is given to this disease by Professor Sherki since 1993. This is the Lifa, which is the rough instruments used in Iraqi baths commonly. Carry the same name or another name? The exact etiopathogenesis is not very well known, but it is speculated that this rough material, rough instruments, by friction with the skin, especially over bony prominences, leading to squeezing the epidermis and the expression of the melanin into the underlying dermis. This is by mechanism of pigmentary incontinence. These changes are proved by histopathological assessment of these patients and also by Woods-like examination. Actually, the deep situation of the pigments make the treatment of this condition is difficult. All patients have pigmentation that have many forms. The main presentation is that the pigmentation is over bony prominences. It can take many shapes. In 100 patients with this condition, we found that 94% of these patients were female. So it is disease of female, and only 6% were males. The age usually from 16 to 45 years. The main presenting feature is the bad cosmetic presentation. Although 73% of these patients have itching, but actually the main presentation was the bad cosmetic appearance. Pigmentation was bilateral, symmetrical, and the most commonly sites were in our patients was the clavicular areas, upper back, lateral aspects of the arm, shin, and the Adam upper. The morphology of the pigmentation is also varied. The most common pattern was the rippled pigmentation, which is the most characteristic type of pigmentation of this disease. I think here is the either rippled pigmentation. Sometimes we get diffuse pigmentation, and in other patients we may get just small spots of pigmentation. Treatment, as we see, it is difficult. Now I present only some options used by Iraqi physicians. The first treatment was a topical lactic acid cream, 6%, in combination with topical steroids. Actually, this combination was found to be useful in Lifa disease and also in melasma. The other mode of treatment was the lactic acid peel, using full-strength lactic acid, 92% concentration, applied on the lesions, only on the lesions, and with cotton-tipped application. Lactic acid was left for 10 minutes before removed with water. The number of patients included was 44 patients, and the lactic acid peel repeated every 2 weeks until getting the desired response. The maximum number of sessions was 6 sessions. These are the results of the lactic acid peels. The score in the beginning was 3 in all patients, but it reduced to 1 in 30 patients and reduced to 2 in 14 patients. And as you see that, it is reduced to score 1 in patients who are getting more sessions. So with continuation of the sessions, we expect more improvement of the condition. As we see in this picture, this is before and this is after, and we see big difference. Depending on the photos taken before and after treatment, 2 dermatologists evaluate the response of patients to this treatment, and the mean score of the patients reduced from 7.3 to 2.7, and the difference was statistically significant. Patient satisfaction, also we get good satisfaction from all patients. It is worthy to be mentioned that all patients getting itching disappearance within just 3 or 4 days after lactic acid peel. There is very rapid improvement of itching after this application. The other study also done on this disease using laser therapy, using Q-switched and DIAG laser therapy 532 and 1064. 19 patients were included in that study. We used 2 rectangular, areas of the bag measured by 10 by 5 square cm, identical on both sides, right and left. And on one side we treated with 532, and on the other side treated with 10,064. These are the parameters used in this study. Also, before treatment, we have a score of 3 in both sides. It reduced to 1.4 on the 532 side and reduced to 1.27 on 10,064 side. And this is expected because the 10,064 reach to deeper layers when we have the pigments in the deeper layers of the skin. So it is expected to be better than 532, although the difference is statistically was significant. And also the visual analog scale showed more improvement on the 1064 side. As you see here, there is a great improvement on both sides, but more on the side treated with 1064. So the improvement on both sides was sustained, and this is important, without any obvious relapse. This is actually a relapsing and recurring disease, but we have no relapse after laser therapy. And of course, the main treatment is to avoid this roughing with this rough material. In conclusion, all the methods used by us were beneficial, but actually the lactic acid peel was very beneficial for the patients with large areas, and in most of the patients we see involvement of large areas of the body. Because actually, once the patient noticed some pigmentation, she tried to remove this pigmentation by further roughing with Lifa, and lead to increase the area until it reached large areas. But the laser therapy is more beneficial for the localized resistant areas. And thank you very much.